La prohibition, c'est que si on prend l'exemple du début du siècle dernier, la même guerre était contre l'alcool et le tabac. Il y a des gens, quand on a donné les permissions, les licences, il y a des gens qui ont continué à prendre, donc à fumer ou à boire de l'alcool, et il y a des gens qui n'ont pas fait. À mon avis, c'est une guerre qui ne va pas réussir, qui n'a jamais réussi, et au contraire, comme on a dit, ça a donné un mauvais impact sur les jeunes, sur les usagers, et ça n'a pas été... Donc actuellement, on parle beaucoup plus sur l'approche comportementale. Si je vais vous convaincre, ça serait mieux que de vous exiger de faire quelque chose.
Might not be the answer. Alcohol and tobacco are legal, they are regulated, they are taxed, and they kill more people, 10 times more people than illegal drugs.
At the end of the Second World War, the Americans, in a sense, were the key drivers behind bringing into existence the UN conventions, which are a one-size-fits-all solution. So it's a way that they're saying in the world that this drug, alcohol, is okay, and all of these other drugs are wrong.
Our focus of society is only on the people who have extreme problems, and they think then that's a problem of the drug. They don't see the context of, in which these problems may arise. To say it bluntly, prohibition is a historical aberration. It is a mistake. Yeah? We know that, we have seen that, how it worked with alcohol. It's a very clear example, but we now more and more also see that it's a big mistake when it comes to drugs.
People in the community to understand that drug use is not just something that nasty, evil people do, but the whole community uses drugs. And there's a lot of hypocrisy about the way communities think about people who use illegal drugs. Even illegal drug use is very widespread in the community, and there are celebrities who use illegal drugs, and there are homeless people who use illegal drugs, and everything in between. And not everybody who uses illegal drugs gets into terrible problems from it. Some people use illegal drugs, enjoy them, and keep on using them, and then maybe stop.
One of the issues that I didn't even touch upon is mental health. And there are so many people within the mental health system who have got a diagnosis for mental health but are not being medicated accurately. And so what happens is that they go to the drug market to buy the drugs in order to make them feel more comfortable.
We've had 50 years of the war on drugs, and people are starting to realise that the war on drugs has been a failure. Even the most conservative politician now has to accept the facts that the war on drugs hasn't got rid of drugs. And so what we're doing now globally is we're looking for other solutions. We're asking what could work, what will deliver the better public health outcomes that we want. Because one thing everybody shares in this industry is that we all desire better public health outcomes. It's just we're not sure how to achieve that goal.
Public enemy number one in the United States is drug abuse. In order to fight and defeat this enemy, it is necessary to wage a new all-out offensive.
Over 40 years ago, the U.S. government launched a so-called war on drugs to try and stem the flow of illegal drugs such as cocaine and heroin into the United States. It's now quite clear that that strategy has failed abysmally. Not only are drugs cheaper and more readily available on the streets of the United States than ever before, but in Latin America, which has been the primary focus of the U.S. war on drugs, we've seen increased consumption, increased production and trafficking routes, which have exposed more people to drugs, and more importantly, have exposed more people to corruption and violence, the corruption and violence that's caused by the criminal organizations involved in the illicit trade. So countries in Latin America are starting to say, this isn't fair. We're paying a very high cost for carrying out policies developed in Washington that are devastating our societies. It's time to rethink what we want to do to try and address the drug issue.
I think they want prohibition because the money goes to criminal societies as long as it's illegal. And I think all the consumers should have the right to go, just as you buy tobacco and alcohol, which is one of the worst drugs. Both are among the worst drugs. But we know what we get. We have a price regulation and everything so that we can use political measures. If it's too many young people, too much problem use, those kind of problems, then we can use political measures when we restrict them. But when it's prohibited, you just have one way to do it. It's repression or even more repression, and we know that does not work.
Prohibition is killing a lot of users. Lots of small dealers and so on, and is keeping them apart from health centers because they don't want to be marked and criminalized and so on, so they don't go and search for help. So I believe that if things are clearer, more transparent, more people when they need, because a user is not always in a problematic use. Most of the time it's okay, and the problematic users are just a small percentage. So if this became more transparent, I believe it would be easier to reach the real vulnerable groups and to work with them and try to break down this stigma question, you know.
I think there have been a number of incredibly serious negative consequences related to pursuing this war on drugs approach. Key amongst those are the fact that we have prioritized law enforcement and criminal justice over the health and human rights of both people who use drugs, but also other vulnerable people caught up in the drug trade. So, for example, people who are growing crops deemed for the illicit market, but they're growing them because they have no other economic alternative. But under the current war on drugs approach, we also criminalize them, and we have massive crop eradication schemes that completely take away their livelihoods without giving them any sustainable alternatives.
Women who are drug users, how they actually get treated when they are pregnant, what actually happens to their children once they are born. You know, there are still countries that will remove the child at birth.
Well, we don't have global legislation, right, about drugs. What we have is we have the UN conventions who are telling us what the drug policies of individual countries should be. So if you look at availability of pain medicine, for example, the conventions basically tell countries that substances that have medicinal value should be available for pain, for other treatments. So let's take a look at availability of opioids for pain management. across the world, people are suffering in pain because there's not enough medicine for them. Because the regulations which would make it available at country level are so difficult that physicians just don't want to bother. So it's interesting that countries choose to over-interpret certain pieces of the conventions and completely under-interpret others. So I think it's really, really important to think about people who produce illicit substances in terms of development, right? If people have very few options, they will do what makes economic sense to them.
So in many ways, I think that relationship of consumer and producer countries is very, very analogous to other kinds of capitalist exploitive relationships between high-income countries that farm out their labor to poorer countries and exploit labor to have cheap consumer goods back in the high-income countries. But again, as with everything else, the criminal nature of the market when it comes to drugs makes those relationships, in some cases, even more exploitive and gives people even fewer options to try to resolve them.
Simply look at, the global map. Yeah? We see now drug use coming up in countries where, and drug problems coming up in countries, for example in Africa, where there's never been the drugs that they're now having problems with. So why do they get there? It's simply because, law enforcement targets trade lines, yeah, and they get their hands on like some organization that runs drugs, say to Portugal or to Spain or whatever.
We've seen some revolutionary changes in Colorado, Washington and the US, where we now see a recreational market for cannabis. That's revolutionary because the war on drugs was started in America. In Uruguay, we now see the government taking control of the cannabis market and again strictly regulating it. We hope that these initiatives will deliver on the goal of better public health outcomes and at the same time deliver tax revenue to the government to help educate the public about safe use of these kinds of products. So we're at this turning point in the war on drugs where we're moving towards a more harm reduction focused solution that ultimately I believe is the only way forward.
The drug market is the real problem, and the only way we can get rid of that drug market problem, we'll never get rid of it completely, but the only way we can really reduce those problems is by regulating drug supply. Difficult, but somehow we'll have to figure out how to do it, and the place to start with is with cannabis.
Existe en esta última década quizás un mayor empoderamiento de las personas que consumen drogas en cuanto a defender la idea de que no se trata solo el hecho de consumir drogas, sino se trata de una cuestión de defensa de la dignidad. O sea, yo como persona adulta tengo el derecho a decidir qué hago con mi cuerpo, qué hago con mi vida en definitiva, qué hago con mi destino. Esa filosofía, por llamarlo de alguna manera, se ha venido empoderando, ha ido empoderándose de algunos espacios en la discusión pública y en la discusión política, y ha sido trascendental. ¿Sí? Ese paso está siendo trascendental porque, claro, no solo coge el tema del consumo de drogas, sino también otros como el aborto o la eutanasia, qué sé yo, el derecho a decidir yo qué hago con mi cuerpo. Pero claro, son pasos tímidos, incipientes, ¿sí? A mí lo que me gusta es que las nuevas generaciones son capaces hoy día de plantearse frente a la autoridad y decir, mire, nosotros tenemos el derecho a hacer tal o cual cosa.
Es decir, cualquier planta que consumida con un mínimo de transformación uno pueda producir por sí mismo, pues se podría aplicar. Yo creo que de todas maneras para cada sustancia, para cada lugar, para cada caso es necesario ver cuál es la idiosincrasia, cuál es la realidad social que hay ahí, ver cuáles son las fórmulas que pueden funcionar. Esto, en definitiva, es un gran experimento social para reemplazar a otro gran experimento social fracasado que ha sido la prohibición. La prohibición nos ha dejado sin modelos de referencia, llevamos décadas sin tener un modelo al que poder mirarnos, digamos, en el que poder vernos reflejados. y como tampoco se trata de sustituir un modelo de prohibición mundial por otro modelo de regulación mundial igual para todo el mundo, porque no todos somos iguales en ese sentido, pues yo creo que lo que tiene que haber es un amplio margen de maniobra para que sin caer en el prohibicionismo, sin entrar en las dinámicas que hemos tenido hasta ahora, con una serie de limitaciones y de restricciones razonables, pues yo creo que se pueden encontrar diferentes fórmulas. Yo creo que hay un largo trabajo, pero yo creo que los principios están claros. El principio es respeto a los derechos de los usuarios, respeto a los no usuarios, salud pública y reducción de riesgos.
So for me there are two issues. One is drug laws must match the culture of the country. So very liberal drug laws work well in some countries, like the Netherlands, because they are a country with a history of being liberal and tolerant, and the Dutch really aren't that crazy. For a country like the UK that doesn't really do moderation, maybe reducing drug laws might not result in such a positive outcome. So the first, drug laws must match the culture of a country.
That's one of the parallels. The other is the issue of how you regulate drugs, because as you know there's a big debate about, well, if drugs were legalized, how could you regulate them? You know, would it be through pharmacy sales, or would it be by prescription, or just how would you do it? And we don't know how you would do it. We do harm reduction all of the time. You know, all around, you know, road traffic legislation is harm reduction. Driving cars is dangerous, but we reduce the harm. Electricity, dangerous, but we reduce the harm. We learn to live with these things. And that's why drugs harm reduction was so important when we first started to develop drugs harm reduction way back in the 1980s, because I was there when we first came up with this idea. People like using drugs, they want to use drugs, or they need to use drugs, whatever, the hundreds of reasons for using drugs. You can't stop that. You might reduce the volume of consumption, but you can't stop it. So the issue is, how can you help people avoid hurting themselves?
A lot of the time, people only focus on critiquing the war on drugs and highlighting the costs, but we want to show what the alternative approach is. So we want to critique the current policy and then show what the solution is. So obviously we've been producing a lot of work over the past several years that demonstrates how a new approach can be established. And it is quite an inspiring, great vision to look forward to, really. We hope to provide people with a blueprint for regulation in the future and to show them how it can be done, because we think that people are more likely to accept the arguments for reform once they can see what's going to come after legalisation. We outlined a whole range of regulatory models for controlling the supply, production and use of essentially all traditional illegal drugs. And our approach is essentially based on the idea that the riskier a drug is, the tighter the restrictions and the regulations need to be. So for example, drugs like heroin will only be legally available to registered dependent heroin users, and they can consume their drug in a medical supervised environment. We're not talking about making heroin available in supermarkets, we're talking about a pragmatic harm reduction approach. Under our model, we think that legal regulation means controlled availability, not increased availability.
Well, I suppose to start with, we'd be in a position where we'd be able to regulate what drugs are coming into a country. And not only would we be able to regulate them, but we would also be able to put strategies in place where people are supported by health authorities. Now, one of the things that we have to be careful of is that we don't move from being stigmatized as a criminal to being stigmatized as somebody who's sick. But even so, if we had to remove prohibition, we could regulate the drug market, we could introduce health strategies that would allow people who use drugs to live healthier, functioning lives.
If we made some drugs more available, say magic mushrooms, MDMA, cannabis, they would fill an important niche in the drug market, and you may have less use of some of the stimulant drugs like cocaine, which can have a much bigger effect on people's health. And you may find that you reduce the size of the cocaine market by allowing people access to some other drugs which have the less potential to harm people's health.
New Zealand is in a very interesting position right now. We're the first country in the world that has attempted to regulate novel psychoactive substances, NPS. NPS is an issue that all countries around the world are dealing with, and the traditional models based on prohibition simply do not work when it comes to these new substances. And so what New Zealand's done, because we've been dealing with this issue longer than anybody else, is we've attempted to regulate these products. And what we've said is this, we've said if you can prove, a manufacturer can prove that they are low risk, then you can get a license to sell them, but only through a strictly regulated retail channel of licensed retailers where there's guidelines around age, packaging, labelling, advertising, very strict guidelines on how you present these products. And of course, in that environment, we can give good harm reduction advice to customers. This is a new approach. It's very challenging because there's opposition, there's a lot of debate as to whether or not this will actually deliver on the harm reduction goals that we hope it delivers on. And it's not perfect, but we all agree it's better than prohibition.
When I talk to people about the global legislative climate, I do so with much more hope than I would have 5 or 10 years ago. It feels to me that there's a critical mass or build-up pushing for a rethink and hopefully an overturn of the prohibitionist stance.
I feel this is the moment for civil society to speak up. And if things doesn't change, it won't be because we are not there, we're not saying things, we're not talking to people, so that's more or less what I'm trying to do.